Welcome to Let's Talk Jonesboro. Our guests today are two gentlemen who are with ARcare and are helping fight the opioid epidemic. We have Mr. Frank Vega and Dr. Ronald Only. Thank you, gentlemen, for joining us.
Glad to be here.
First of all, let's start with the basics. Tell us about ARcare and what ARcare does, Mr. Vega.
So with ARcare, we are a federally qualified health center, and what that means is that we provide primary care services in underserved areas. And so ARcare started off about 30 plus years ago, serving a small community in central Arkansas, Augusta, and from there we have grown to where we have clinics in many parts of the state, and we provide behavioral health care services and primary care services.
And you're starting a new program about opioids. And Dr. Only, everybody has heard, I think at this point, that opioids are a problem. Can you tell us what you see as a doctor regarding that lets you know this is a crisis and this is something that needs to be addressed in Jonesboro?
Well, over the years, it's kind of changed. In the beginning, I was seeing a lot of heroin addicts coming in for treatment because they had a friend or someone who died recently, and they were worried. But now, lately, it's been more and more people who have been on chronic pain pills for an extended period of time, and that's become more and more popular. Some of them, deservingly, they were injured and just left on them too long, and others were playing around with them, got addicted, and came in for that reason. But it is definitely a problem.
How did we get here, and how do we get away from it?
Well, I think there needs to be a lot more education out publicly and also amongst the physicians, because this is a problem that, unfortunately, as a physician, we're partly responsible for. And that's the only way I believe this problem can be solved.
And Mr. Vega, you guys, where do you see, and I've heard different, I guess, perspectives. It's either overprescription or it's some black market drugs that come. What is the source of most of these pills?
What we've seen, and there is a transition, is, as Dr. Only said, that it starts off, or in many cases, with a prescription for an opiate. And then we've really begun to treat pain as a disease versus a symptom. And by doing that, we try to eliminate the disease through the use of medication. And so the overprescription of opiates has fed that. Now that there's more of a crackdown on prescription mills and easy access to to Oxycontin and those types of medications, we're starting to see the transition to more of the illicit drugs like heroin and fentanyl and other things that are much more dangerous than the prescription medications that may have initially brought someone into their addiction and their struggle.
And this is something that you're seeing. It doesn't hit a particular demographic. It doesn't hit any particular area of the United States worse than the other. This is universal. Is that?
Yes, I've seen patients who were a step away from being homeless, and I've treated them, and I've treated physicians. I've treated pilots. I've treated teachers. I've treated mathematicians. I've treated engineers. I mean, the list goes on and on. There's no demographic difference.
So, how does a doctor know when a patient is in actual need of these type of medications or is maybe addicted and not needing them?
Well, typically, a patient would come into your office with a pain complaint, and you may think it's bad enough that he needs a pain medicine, or she, and you give them that medication. You give it to them for a short period of time, maybe 2 weeks. They may come back in and say, "Oh, I still have pain." Well, then personally, I start to worry. You know, at that point, it's like, well, does this patient really have pain, or does this patient really want the meds? You know. Then it's up to the doctor to continue the medicine. Personally, I wouldn't continue it for longer than a month. However, some doctors continue it for years. And those people, even though they didn't have a problem when they started, by then they do have a problem.
Because the addiction rate is probably 100% if you take them for over a long period of
Oh,
time.
yes.
Okay.
Yeah.
And that's where treatment approaches like what we have at ARcare actually come into play. We have partnered with Hazelden Betty Ford to provide some training for us. And so the program that we use is called Core 12. And it's a combination of the medication-assisted treatment where a prescriber will prescribe a medication like Suboxone or one of the buprenorphine-based products to assist a person with an opiate addiction so that they aren't in chronic withdrawals. And the goal is to transition them off of that medication. But before you can do that, you have to address the underlying behavioral health issues, the lack of coping mechanisms or coping skills that they have in their lives as a result of early childhood trauma, for instance, or just some struggles that they've had throughout their lives that may have contributed to their addiction. Just this morning, Dr. Only and I were meeting with a patient, and I was doing the behavioral health assessment and talking with this person about all of the life experiences that they had had. When I talk to individuals about that, the way that I approach it with them is that you have done what you have done in order to survive, and now you need to learn how to live. And you get to define what living is. And once you learn to live, and that's learning the coping mechanisms, addressing the trauma or depression or anxiety that may have contributed to their use, then you can learn to thrive. And that's where the dreams that we all have for our lives come into play. And it's really helping those individuals with the use of medication and cognitive behavioral therapies, community-based supports like NA and AA, to develop the skills that they need in order to be content with who they are and not need a substance to augment their lives.
So you guys have a program. Do you have a location in Jonesboro?
We do. We're located at our Jonesboro Midtown Clinic, which is 416 East Washington.
Okay. Will clients or patients be referred to you from their primary care physician, or can they call you and have insurance make an appointment?
They can. They can be referred from their primary care physicians, or they can just call, and we will take some demographic information. We are not a cash-only clinic, and so we will bill their insurance, and we also partner with a pharmacy to provide the medications. And so we really take that holistic approach in dealing with the individuals and provide the services that they need. So they will see a prescriber when they come in and a behavioral health therapist. And we will do the behavioral health assessment. And then if it's determined that this is an appropriate fit for them, then they'll be referred on to Dr. Only or one of our other prescribers to start the medication that's part of the program as well.
Right. And Dr. Only, if I say, this is hypothetical, but say it's a rainy night, you have a council meeting, you don't have an umbrella, and you're the communications director, and you run out the back door of the building and trip over a step, fall and potentially break a bone in the gravel down there, and the councilman that pushed you is nowhere in sight. I come to you, you prescribe some painkillers for me. Will you determine, how will you determine how many, and what will you tell me about taking these painkillers?
The first thing I tell you is that they're highly addictive. And I will tell you that if you take these painkillers and they give you energy, that's a problem.
Explain that.
When I take if I take an opiate, it'll relieve the pain, but I want to sleep. I get sleepy. I really want to do much else.
Right.
When an addict takes an opiate, it gives them energy. They want to clean the house. You know, they want to hang out all night. That's the difference that with an addicted, a brain with the addictive gene and a brain without. That's really the major difference.
That's very interesting.
What they tell me in the behavioral health assessments that I do with them is that they feel normal. That they feel just like you and I would feel if we hadn't taken an opiate.
Right.
And that's the issue that I think that many people that don't understand addictions don't grasp.
Right.
Is that they begin to use in order to feel normal. And that's an important thing for us to understand that, it's many times it will be, as you asked earlier about the demographics, this is an issue that affects every social strata that we have. And the more open and honest we can be about the discussion that we have with individuals about being addicted to opiates and the use helping you to feel normal, then we begin to take away some of the stigma that's attached to substance use and substance abuse.
Right. Right. Is it different than illegal drugs? Is there any difference? I guess, is it safer, or is it? What are your experiences?
Well, I think there's no safe opiate.
Mm-hmm.
You can die from any of them.
Okay.
They can all kill you. If it's prescribed by a physician for a short period of time, it's prescribed under safe conditions. If it's bought off of the streets, you really don't know.
You don't know what you're getting.
That's right. You don't know what you're getting.
Like any illicit drug,
Mhm.
I would assume.
And we do urine drug screens for all of the patients that come in, and of course, you have to weigh whether or not they're being completely honest with you or not when they have a positive drug screen, and they say, I've never taken ecstasy or MDMA that shows up on their drug screens, and then my next question to them is, do you know where you got where the drug actually came from? Because there are things that are mixed with all of the illegal substances, and even things that look like the prescription medications can still be tampered with, and so you never know what you're getting, as Dr. Only alluded to earlier.
So, what will this facility now in Jonesboro? How long have you had it open?
The clinic has been open for several years for the primary care.
Mm-hmm.
We have just begun to provide our medication-assisted treatment services within the last month. So January of 2019 is when we really kicked it off.
Was there a large turnout initially?
Not so far. We really take the approach in a really regimented approach is probably the best way to say it.
Okay.
In our other implementations, what we have done is we'll admit between 5 to 10 individuals first off, and then stop and re-examine what we're doing to make sure that we're adhering to our treatment philosophies and our policies and procedures, because it's easier to correct things in the very beginning than it is once you've got the program fully established. And so that's the approach that we take. There's also some limitation that prescribers who have never prescribed Suboxone or buprenorphine-based medications, the Drug Enforcement Administration and SAMHSA actually limit the number of patients to 30 for the first year for a new prescriber. And so that limits, in some cases, the number of individuals that we can take into the program. And so we take all of that into consideration as we launch a program.
Okay. So what you're saying is this is something that's just now beginning to grow.
Yes.
And you anticipate a whole lot of potential patients in Jonesboro just because of statistics.
Yeah, I can give you some of those statistics if you'd like.
I would like.
For this particular county, for Craighead County. Is that correct?
Yes.
Craighead County. This has one of the highest prescription rates of opiates in the state, actually.
Is that right?
the average nationwide is 69 opiate prescriptions per 100 people. Here in the Craighead County area, the prescription rate is 159 prescriptions per 100 people. And so we know that there's a significant issue here in this area. And we're going to do what we can to address some of those issues. Of course, that takes into account individuals that need the medication for short term. But when you're talking about more than 100%, you're talking about 100%, 150% of the population is getting an opiate prescription. And so that would be an indication of a need.
I would think so. Now, I can think of two things that you're going to hear, and I'm sure you have heard. One, Doc, I still have pain. What are you going to give me instead of this? And the other one would be, I'm retired, I'm 79 years old. What does it matter whether I am addicted to painkillers or not?
Right.
What are the answers to those?
Well, for the first one, the person who still has pain, at that point, I mean, if they've been taking the prescription for an extended period of time, then I want to know, where's the pain coming from? You know, what is the reason for the pain? Because maybe if it's something surgical, you know, we need to find out. So I would do definitely more investigation at that point. For the 79-year-old male or female, what I would do is I would tell them that, yeah, you may feel that way, but you may live to be 95. You know, nobody knows how much longer they have on this earth, but I guarantee you, if you stay on this medication, you won't last that long.
You won't have enough.
Yeah.
Gentlemen, is there anything else that we need to cover that I haven't mentioned? We're good? Okay. Well, I want to say thanks to Frank Vega, the Director of Behavioral Services at ARcare, and Dr. Ronald Only for joining us on Let's Talk Jonesboro. Please be sure to follow us on Facebook and all your city services at jonesboro.org. Thank you very much, gentlemen. Thank you.